Everybody, welcome to One More Round. Today, I'm excited. We have an excellent conversation coming up. Scott and I recently met maybe about a month ago. He had reached out to me. I was on his podcast, but then we had lunch and we've gotten to know each other. And he solves a very unique problem. And this problem is something that a lot of people aren't talking about. And I want to make sure that we're bringing exposure to it. And what it is, really, it comes down to talking to people that are aging and what it's going to take to make sure that they have the care that they need, whether it's reconstructing their home and making sure there's things in place to where they can age in place, or find a facility that can help them get the care. And his company does exactly that. He's one of the OGs really in this entire Phoenix metro area that started this. He started organizations. So Scott, thanks for coming on today. And if you want to just give a little background, I'd love to hear it.
Well, Josh, thank you, man. It's really good to be here. I've just enjoyed getting to know you the last month, and I think there's such synergy, and I appreciate getting a chance to do this with you, and I think we got a lot more conversations to have. I went to Arizona State University. I went to nursing school a long time ago when very few of us were in nursing school.
Yeah.
And through the 80s, I spent most of my years working in the areas of mental health and psychiatry. I even worked exclusively with really troubled kids for a long time, and it was a situation with one of those kids. We were at a long-term residential facility we were working at, and he was agitated. We were restraining him, therapeutic restraint, and I ripped all the ligaments in my hand. Mm-hmm. And life sometimes closes doors, and we say you look for the window or you look for the next avenue to go. And when I recovered from that surgery, I realized I couldn't work with kids anymore, and I was looking for a new avenue and a new clinical way. And I started at that point in early 2001, working specifically with seniors who were suffering from different forms of dementia, and they were having psychiatric parts to all that. And I was working for a company where I was the eyes and ears for the clinicians and the prescribing physicians to go out and help them manage the medicines, manage behaviors, and helping the families keep their family together. Or I was going to the assisted living facility because these guys were agitated and hallucinating, or they were up all night. I mean, there's a lot of things that go with all that, right? At the same time, as I'm approaching my 40th birthday, I'm like, I would love to be my own boss once. And a new industry was emerging here in Phoenix that we call now the senior referral and placement industry. And I was talking to various different senior living providers and residential group homeowners about what do you do to get into this, and they're like, well, there's no barrier to entry, there's no license, if you want to be one, you are one. So I'm like, wow, that's a good business. So that was my dive in. I was 40 years old, and we are now in our 24th year. That business is called Options for Senior Living, and we provide a no cost to families guidance and consultation service to help them navigate the complexities of the long-term care and post-acute healthcare system and help them find the right long-term care, assisted living care. That's our primary business. However, over the last several years, more people really want to age in place, like you mentioned, and they want to stay home, or they want to stay home longer. And so that's fine as long as we can manage risks and keep bad things from happening for them. So we're talking to people way earlier in the journey now, and we're able to help them put together safety plans and aging in place plans that help them maximize their own autonomy, maximize their self-reliance, and help them safely navigate this. I think when we were at lunch, we were talking about the fire departments in Phoenix, just the greater Phoenix area, just slammed by the number of people that call them for help and stuff, and so we're trying to make an impact that way.
Well, and that's we'll kind of start diving into that, because that was a very interesting problem I didn't know existed. Because you were talking about basically the city of Scottsdale and the fire department, like they would get a call if mom or dad fell, right, and needed help, and they were getting multiple calls from the same household, right, which is taking resources away, like taxpayer dollars, for that problem, and there's really no solution other than that. Right. And the challenge is you have all the other things that they need to be doing, and when you pull those resources, and you had basically worked with them on creating a solution to then go and talk to some of these folks.
Right.
So what does that look like? Like when you go into a home, you get that,
I wore my Scottsdale badge today too, just because we're part of the unpaid staff at Scottsdale Fire to help them. And they call it their Home Safe Home program. So you're right, the firefighters would go in, they'd be in and see Jim and Millie for the second time, the third time, the fourth time, and going, you guys, we've got to do something different. And that Home Safe Home program didn't have any teeth to it. So now, Scottsdale Fire has partnered with a number of us through the Right Care Foundation to bring a solution to the table. So we were able to go ahead and map out for them what the issues are, identify all the problems that are in the house. There were really 5 challenges with aging, and it's pretty simple. It's safety, it's independence, it has to do with managing your medical conditions, right? And then there's burden of care, you know, the outgrowth of all that to the loved families, and then there's quality of life. So we go in and do a whole assessment around all 5 of these areas. Scottsdale Fire was picking up last year over 5,000 people. They ran the trucks out.
Yeah.
So it's $1,500 every time they run. That's a lot of money. The other part of this that complicates things is while they're over at Jim and Millie's house and now Fred's having a heart attack, their time to get to Fred has gone up by several minutes. And so they're now seeing their mortality rates rise because they're so busy. About 80 to 90% of what they're doing is running around picking people up and helping them with medical calls, not fighting fires. And so you have longer wait times for the guys to show up. They got to call guys in from farther away to get over to, you know, to Fred's house. And so Scottsdale Fire, God bless them, has done this very proactively. There's other departments around the greater Phoenix area that are now actively engaged. They know they need to do something, and this is what a community way to pull together and help our community and give families the resources they need.
Well, and it's an amazing program too, because it's going to be very, very tangible to track, right? It's going to be very easy to see year over year what happens as far as time to call, the mortality rate for some of these incidents, how many firefighters are able to get to somebody and save them. Like, they'll be able to track those metrics and show the proven program. And wouldn't it be cool if, like, this program could spread and be, you know, in everywhere in Arizona?
Well, we hope so. Just yesterday, my wife does some volunteering at the headquarters to help the volunteers that are in place already kind of triage all the calls. And so we called a bunch of families yesterday. 3 of them want us to come out and do this head-to-toe assessment and meet with the family. We've done a couple others this week. And we're not even fully rolled out in Scottsdale. Like, they haven't turned the water onto this. When one day everybody in their water bill or something's going to go, hey, notice that if you have a challenge, let the department know we have a plan and a program for you. So we've been building the team of providers. We call it the care team that's wrapped around the fire department so that we can respond and give people that roadmap that they need to age in place safely.
Yeah, that's great. Yeah, and one of the unique things, like when you would explain the age in place, like you have a report. So you'll go into a home and you'll basically assess all the risk assessments of potential dangers, right? And things I didn't think about, but so I'm the president of the National Hispanic Construction Alliance, and one of the things that we have is a lot of general contractors. Well, that's a niche, as I started talking, that some of them are like, yeah, I'd love to get into. There are things like, tell me a little bit about what you're doing to a home to make it more
safe.
Safe.
Yeah, so when we do the safety assessment, we're looking at 144 data points. Some of those have to do with the person, like their medical conditions and their blood pressure and their weight and all that kind of stuff. Some of them are about their environment. So their shower isn't safe, there's unlevel surfaces, there's things like the environment have to be adjusted. And then there's tasks that people do. So when they're taking showers or getting dressed, that's often the time those accidents occur, right? Getting out of bed, transferring.
So one leg.
So we the assessment is made up of a module of stuff around each one of those areas. So when we're looking at the environment, you walk into somebody's bathroom, you can immediately see, well, this isn't safe. Like, there's an old school tub that's been there since 1972. There's no other showers in the house. They've got to get a shower bench or step over a 2-foot threshold to get in. You have to get a handheld shower device. You might have grab bars all over the place. You have slippery surfaces that get wet. They get slippery, so you have to get nonstick tape down. sometimes you'll see people on their walkers coming up to an old narrow doorway, and their walker's too wide for the doorway, so they leave the walker outside and then walk in without it. And you're like, oh man.
Something you would never think about.
Right.
Yeah.
And you just watch them. They pick it up, they turn it sideways, and then they kind of shimmy through, and they get out, and you go, oh. Yeah. And just because people are getting away with it doesn't make it necessarily safe. They're just getting away with it, right? So we look at that and go, okay, well, what can we do is if we need a contractor to widen a doorway, put a 34-inch doorway in, or if they're in an indoor roller wheelchair or something, you need a wider doorway. If their walker, you can't narrow the doorway, or if you can't widen the doorway, maybe I can narrow the walker by getting the wheels turned on the inside. And so they're not on the outside. You get them on the inside, so you save 4 inches and you can get in the door with it. There's just simple things that we can do, or I could get a contractor in. And they can do, and of course, you do a whole bathroom reno and make the whole thing like a big wet room or something. That would be ideal, where there's no thresholds and it's all sloped right to drain. And but when you start looking around people's homes, and when we go into people's homes, the average number of risks we find collectively is about 60 of the 144. Wow. Now, the threshold, statistically, this tool that we use has been researched over 20 years. 70-something thousand families have had this tool done. And so when you score more than 40, it is a red light going off in your house that it's not if, it's when. So when we go in and there's 56 or 62 risks, the only thing that's going to stop the next unsafe occurrence from happening is to get the risks reduced. Yeah. So now we've got a game plan, right? We're going to change up the walker. We're going to get them the right equipment. We're going to get their bed rails in. Wherever they're having the challenges, we now have a whole menu of things, and they get a report from us and a solutions page that we could follow up with them on and have reason to go back and see them and get other professionals or other disciplines in to help them bring this all under control and help them age safely.
Right.
Right.
Yeah, so a lot of our clients that arrive, or I should say we have a lot of clients that are 50s, late 50s, 60s, and it's their parents that are in their late 70s, 80s, sometimes 90s, that are still living at home. And I do find that with that sector of my clientele, we're talking about their parents. Because usually it starts with the estate planning side of things, because that's what a lot of people will come in for, make sure they have their trust in place, their powers of attorney. And then they'll talk about, well, my parents, we need to make sure theirs is done. And mom and dad, like, they're living at home. They're not doing too well. They're not getting around. I'm kind of trying to get them to move into some place that has assisted living, whether it be, individualized or, great communities like Friendship Village that, are designed to help people all the way through, right?
Right.
And they have a lot of it's hard for them to have the conversation. And I try to guide them a little bit on, hey, well, sometimes it's just sitting down with them and saying, hey, look, I want to make sure that you're safe and that you have the care. And, we were just talking about the older generation, that, that boomer generation, they don't want to hear it. They don't really want to talk about it. And what have you found are good strategies for kids to talk to their parents that are in that position?
Yeah. Oh, I'm one of those kids. Lost my mom last year after a long 10-year journey. My dad passed just before COVID, and he died suddenly. But with we had a 10-year journey with mom. And so the number one thing about your clients and about folks my age, in that 45 to 65 slot, is that there's a real misunderstood phenomenon we call burden of care. And it's part of our assessment tool. And so when the burden of care is up, there's about 16 things that we look at that can help the adult kids reduce the burden of care. And it can be spouses taking care of spouses. You got a lot of that. But when it comes to us as our generation trying to help the folks that we love so much and have cared for, we've got to understand what those intricacies are of the burden of care phenomena are. And I've personally lived it, and I'm even though I lost my mom 6 months ago, the aftermath of the stress is still real to us. an approach I've always had I started with my own mom years ago, and I've told my clients this for 20 years. I never want to do anything to you, Mom, always within 4. I can't stop the clock. You can deny it, but it's not stopping just because you say it's not. So can we come together instead of sitting across the table from each other? Can I sit next to you, and can we do this together? And you've got to have that conversation early, frequently, often as the years go on. The caveat to that was for my mom is until safety, your decision making in safety becomes too much of an issue, then I'm going to have to exert more authority in the situation. Yeah. But I wanted my mom to retain autonomous. People say independent, and we're really talking about having. They understand that they're losing some of their physical capacity to do some of their stuff, but if we could give them the systems and the tools to remain autonomous, then they could stay independent as long as we can, right? And so for your adult kids, it's like, hey, you get next to your parents, you have these soft conversations. If it gets rough or contentious, we have to say to our parents, just because you don't want to address it doesn't mean it doesn't need to be addressed. I'm going to be respectful, but I'd love to get a third person to come in here and talk to us, because a third party will sometimes, unbelievable. My mom would listen to the hairdresser or the pharmacist and not listen to me, or not listen to my brother, the surgeon. So a third person really makes a lot of sense. And I think we have to find really non-threatening ways to bring it up. And so there's a guy that I know, he's a real estate guy over in San Diego, and he's been challenged and inspired to help this population. And he put together his own reality TV show, the first pilot. And it's on YouTube. It's called Senior Spaces. And if you've ever seen an HGTV, like Love It or List It or something, like where you got here's the issue, and you could either do this or this at the end of the show. He's got a reality show for seniors the same way. And so it's very non-threatening. You can watch what he's doing, and he's introducing them. He's engaging them first to just talk about it. Hey, you guys got some age difference. You're a little older than your wife. You've had hip replacement surgery. You've got a 2-acre property. What are you thinking? How are you going to handle this? Oh, and are you able to keep up with the issues on the property and all that? Well, through the show then, he takes them through various scenarios to introduce them to aging in place and doing home modification, maybe even using the equity of their house to do some of it, or do you have some funding that we can fund the 30 or 40 grand it's going to take to make this the safe place you want it to be. Then he takes them on another day. He takes them out to go look at condos down by the ocean, because the wife goes, oh, wouldn't it be great to someday live and have an ocean view all the time, right? So he takes them through this entire process. Finally, he takes them to a senior living at the end. And at the end, they decide, so what do you think? What do you guys want to do with this? And they agree to make a decision, and they decide to age in place. So the contractor comes out, and they fix the deck, and they widen the doorways, and they do some things. It's stuff like that that is engaging and non-threatening, where people go, oh, makes me think, And that's what I think is more of us are engaging. The end of the silent generation, those early boomers, everybody's pretty buttoned up. They don't want to talk. They don't want to be. Their identity and all that's wrapped up in their pride. And I get it. Those people survived the war. Those people the oldest of them survived the Depression.
Yeah, that's right. And one of the things I'd encourage people to do is have the early conversations before there's any issues, right? Then it's not contentious. Then it's like, you're not saying, hey, you need to do this, just like you're saying.
Well, you're the financial guy, right? Yeah. And so wouldn't you want those, maybe the adult kid's your client, but maybe it's mom and dad too. Yeah. Well, what do you advise them to, with their trust planning and their estate planning? So they need to see an estate planning or an elder law attorney? Do they need co-ownership of some accounts that make so in the event there's a sudden death that the kids could get access to mom and dad's checkbook to keep paying for things? Right. There's some things that we collectively as a team around this family would advise them to be safe, so that my show is called "Don't Let Haboob Hit You in the Face," right?
Yeah.
And we want to prevent crisis wherever we can, and so we're trying to give people the tools so that they're not finding themselves in the thick of it at some point, right?
Yep. No, it's one of those things where if you have the early conversations and you're chatting with them and just saying, hey, like, someday if you were to not be able to function like you are now and you're in great shape, what do you want? What do you want? Like, tell me your wishes. And then part of that's estate planning. Like we always talk about advanced health directives. Like those are kind of the extreme cases, of course. But like if I have to take over power of attorney for your financials, where would you like to live?
Yeah.
And when you can have those early conversations before there's any issues, I think that alleviates it. And then to your point, that third party can really be, because I am a third party on, and people will look at me and what my advice is, even on things like that, even though it's, I'm financial side of things, there's that trust factor there. Yeah. So they will listen. One example is, I had a client about a couple months ago. We met. We just finished up their estate planning, and the mom is 83, and the daughter is 62, I believe. And she's like, I want my mom to get this done. She needs to get it done, but she has to hear it from you. I'm like, okay. And I hadn't met her mom. She came to one of our workshops. The daughter did, and then they come in and then ask questions. And because I was like, this is something you need to do, she says, okay, let's get it done. But it had to come from me. And that generation, there's a certain authority that they want to listen to that's not their kid. Because they were telling their kid what to do their entire life. Right?
Yeah, that's where it gets janky for them, because that they just don't want to, they don't want to hear from their kids.
I raised you, So let's talk about the financial piece of it, because, man, I'll tell you what, the expense of long-term care, when you look at the average cost, I mean, what are the average costs of, like,
just when someone calls us and says, hey, I'm going to need assisted living for my mom, if I was going to look at a one-bedroom apartment with moderate care in an assisted living, you're easily spending $5,000 a month. Yeah. You can be spending 7 or 8 in certain places. You could get a little cheaper and stuff, but you're probably in the $60,000 a year. Yeah. Now, where's that money coming from? Like, what pool of money? If you have a private long-term care policy, cool. If you don't, ouch. Now you're self-funding this. Yeah. A lot of people in the state are not funded for the long haul, so unfortunately they're having to then turn their heads to some sort of public funding, and in some families there may be some benefits, financial benefits from the Veterans Administration programs. Some people have to go with our state Medicaid program. We call that Arizona Long-Term Care, or ALTEX. That for some families helps offset the cost of long-term care. If people are spending $60,000 to $80,000 a year, moderately, how many years can you sustain that? So it's got to have a pretty big pool to carry it. Many people that we've helped over the years, most of their assets are in the equity of their house. Yes. They're not managing hundreds of thousands of dollars or millions. They're sitting on a house that they paid $36,000 for, then that's now worth $425,000. That's where the money's at. So we're working with a plan. We're designing a plan for them. We're working with the assets that they have, so that they can adequately cover their care needs for the distance, and also help them make whatever legacy plans or other family wishes for those monies. People have a really hard time letting go of their house. That's where they raise their kids. That's where those Thanksgiving dinners were had, those Christmas mornings. People are really attached. They've been there 50, 60 years in some areas of town.
So as a placement agency, really, that's your specialty, right? Because you can look at somebody, look at their situation, look at their financials, and then design a plan. If I'm hearing this correctly, you can design a plan for them to make sure they have something in place, whether it's government assisted or self-funded.
Correct.
And that's huge. That's like, how would somebody figure that out by themselves?
Well, I'll just tell you a family story. We're in the middle of it right now. So my wife's uncle is 91 and doesn't have any natural or biological kids. He has an adopted son out of state, nowhere near the situation. Our uncle has been on a family trust for some time and younger sister, who's 88, has been helping him manage his life. She's 88. She's she's tapping out,
Yeah.
right? The other brothers and sisters are all also in their 80s, so nobody else wants the responsibility of their older brother. So my wife and I have volunteered to become the successor trustee to this whole thing, and to take care of him. Now he has a little bit of cash and the money in the house, and so all the brothers and sisters are like, well, what if he lives 5 or 6 more years? And he might. His health is really good,
Yeah.
right? So we're designing that plan for Uncle Walter now that will go the distance, and I know where we're going. We'll be meeting his needs for now. If we get to a certain threshold, we know where we have to deviate or change directions. And I've already talked to the attorney that's handling all the restatement of the trust.
Yeah.
She's a very accomplished elder law attorney. I'm like, I'll be back in 5 years if I need alt text.
Yeah.
Because if he, nobody knows what the crystal ball is going to be for Walter.
Yeah.
So we're doing that right now for our family. We've done it for thousands of families that way. Yeah.
Yeah, that's awesome, because I mean, a lot of people, the goal is to live as long as you're healthy, right? I mean, and some people are like, oh, I want to live until, I fall over and just die, whether I'm healthy or not. But I think most people would like a quality of life. But yeah,
It's a
the
huge part
financial
of it.
piece is always an interesting thing, because I mean, there are some government funding
Yeah.
for
Yeah.
that, and obviously the care is not going to be the same.
Right.
So what are the different options of where people can live? Talk about that, because there's everything from communities to
Yeah.
individualized. So,
Yeah. Well, that's in Phoenix particularly, we have 3,000 assisted living homes and residences in the greater Phoenix area.
Yeah.
3,000. Who'd have known? So the bulk of those, or the largest number of those, is what we call those private residential assisted living homes or group homes. The state allows individual to license their private residence. Up to 10 people can live there under the license, and they are licensed to do all kinds of care for people: bathing, dressing, showering, administering their medication. It's all inclusive, and people can live right through the last breath. They can have their hospice care services, everything. Nursing comes right into them up till their end of life, and so they're licensed for that level of care, and they're a wonderful, cost-effective alternative for a lot of families, right? And the selling point on those residential homes is that you get high touch, highly personalized, loving care. These are often mom and pop operations, often run by folks from Mexico and the Philippines and Romania, and and American owners as well. But there's a lot of foreign-owned homes that just give loving care to people. So that's one solution for some people. We have the corporate assisted living centers. Those there's no cookie cutter approach to that. Some of them are large campuses where they have like independent living over here and assisted over here, and maybe even a memory care or skilled. Sometimes it's one building for assisted. Sometimes it's a building with assisted and has a memory attached to it, memory care attached. They're all over the place and they're all over the board. There's no have to on that. But anything over 11 beds and larger is considered a state licensed assisted living center. Okay. So there's some corporate things and commercial kitchens and refrigeration and all the stuff that has to go in. But there's people that have 16 and 30 bed group homes that are like 9 and 12,000 square foot houses that are centers. Yeah. They're the most amazing thing, and they're just full of love and care. But you wouldn't know unless you had somebody guide you or point you to where they're at, right? Yeah. Memory care is a specialized component of kind of corporate memory care or corporate assisted living. So there's usually a secure area where people that might either need higher level of care or they're wandering, and there's a lot of safety risks involved in caring for them. So they have a controlled or confined environment. And so you have these corporate memory care settings as well that people, and they could be freestanding or they could be part of a larger building or campus or something. My team and I do background checks on all these facilities that we work with. We contract with hundreds and hundreds of them all over the country, all over the county. Maricopa County is 100 miles wide, 60 miles tall. I mean, it's a big space.
It is.
So we have a very set practice on how we work with and research facilities to do our very best at matching people up to the right solution for them, based on their cost, based on their care needs, based on their logistics and where they want to be and all that kind of stuff location-wise. So the assisted livings, there is this animal also called independent living where people go mostly because it's the social aspect of it and hospitality. They want to live in a resort without needing any care yet. So there's some really cool resort style independent living properties around the valley now too that really cater to a high energy, fast lifestyle. There is actually senior living that was built on the campus at Arizona State University. There's like an 18-story building right there that has dozens and hundreds of people that live there that are independent living, but it's part of ASU's campus. And so it's an integrated way to age, there's some, the aging, we have 160,000 80-year-olds in Maricopa County.
How many?
160,000 80-year-olds and 1 million people already 65.
Wow.
Yeah.
That's wild.
It's bonkers. So this is why we have to pay attention, and we can't just go, we want to be more proactive, and that's why we're doing what we're doing.
Absolutely. Well, and I encourage people not only to be proactive with this conversation with their parents, but hey, why not plan for yourself? I mean, that's what we do. We do financial planning. Well, part of that is planning for yourself, like what you want your life to look like. I mean, when you're at that age, I know for me, I mean, I don't want to have to burden my family, so I want to make sure that I'm in a place that I can get the care, and I'm more of a, I do like people, so would like to be around people and care.
Think about it from your work. When you have maybe the aged person, the senior, and they're not making financial decisions with their kids, or they're keeping things private, that you know what's coming. There's a setup for agitation. You're going to have maybe the conflict between the siblings, right? Because they have different opinions on what should happen with parents. Well, here's what happened to my mom. We just tried to ask her something simple like, do you want to be cremated or buried intact? You want us to get a coffin or no, you cremate. Okay. Where would you like to be? Would never say. So you know what the biggest conflict I'm having with my brothers today, 6 months after she's gone?
Where to spread the ashes?
Where to spread? My brother wants her buried.
Oh.
My other brothers don't care. My other brothers want to put her in a jar of paint, paint a wall with her. I mean, it's like, it's no joke. We're three, I have 3 brothers. The 4 of us have 4 different opinions, and it's caused nothing but grief for us. And Mom just wouldn't make one decision. And we tried. My wife tried. And so please, if you're a senior and you're listening to us, please, just have these conversations. It's not, you're going to leave your kids with a mess. And if you're the adult kids, if you need a third party, some help, get it so we can help you not slam into some of the walls that are there. Yeah.
Absolutely. Well, this is a great conversation, and I know we're bringing awareness to something that people, this isn't exactly fun dinner conversation, right? You don't grab a glass of wine.
Hey,
let's talk about
you want to talk about safety risks?
Yeah, safety risks. And, I always joke, like, about a third of my conversations with people are about their ultimate demise, estate planning, life insurance, that kind of stuff.
I know.
But it's important. As our, Danny's a mutual friend of ours, Danny Brown, Myriad, he's been on the podcast, and he helps facilitate this, but he always says, you're going to die. It's 100%. And he gets so passionate about it. 100%. You're going to die. Yeah. You need to talk about these things. Because he had some unique stories with people that didn't plan and all that. So I'm glad that we're bringing awareness to this. Where can people reach out to you if they want your help?
Yeah, thank you. Our office phone number is the first easiest way, 602-845-1320. Our website is optionsforseniorliving.com. When you go to our website, you're going to see a picture of the 4 of us, Stacy and myself, and our 2 girls, Molly and Leah. Our logo is "Our family is here for your family." We mean that sincerely. Through the journeys with our parents, we're living it, so we have a high sensitivity to this. This is not just theory to us. Yeah. We've helped over 4,500 families over the last 23 years do this.
That's awesome.
Yeah.
Well, thanks for the great work you do. You can tell you're passionate about it, and it came out of being a nurse, nobody becomes a nurse unless you really care for people.
Yeah.
And it's a great service.
Can I make one more mention?
Yeah,
one more thing that's happening right as we speak. We are in the middle of all this aging in place. I said we were working with folks a little ahead of, more ahead of time than ever, right? And so there's a national organization that has a national mission called the National Aging in Place Council. The NAIPC has chapters all over the U.S. Odd, not one here. So I'm co-chairing the launch of the National Aging in Place Council chapter in Greater Phoenix. We kick off May 28th here. There's two components to this. One is for professionals to get educated on how to safely engage with our consumers and the folks in our community. But for the consumers, the adult kids, and the seniors themselves, we are putting together a group that will educate you, have monthly and bi-monthly community meetings, podcast. More and more stuff is coming, and I'm on the forefront of a conference that's coming to town probably in November, headlined by national TV hosts of a show that's on locally here called Aging Untold. It's on every afternoon at 3 o'clock, and it's a nationally syndicated talk show about all things aging. And some of those we're in conversation now about bringing them to Phoenix and having a big conference so we can reach our community. So I'm really excited about the NAIPC and what that brings to the Greater Phoenix area.
Awesome. Well, I definitely want to be involved. My birthday's May 28th, so unfortunately I can't.
You're gonna be gone.
Yeah, I will. So it's my birthday and it's our 20th anniversary. Our 20th anniversary is the 20th coming up, but we're flying to Tahoe on my birthday, so we'll be there for
one of the best places on the planet.
Oh,
man.
I love it.
Oh, I love it. Oh my God. Yes.
Yeah, that's cool. Well, I appreciate you coming on today, guys. I know you got a lot out of this, and you probably you're an adult child, or you have some parents may need to hear this. I hope we gave you some tools, created some awareness. Share it out with a friend that could use it. We appreciate you tuning in. See you next time.
Thank you.